Well, we're hearing a lot about innovation in this world in healthcare as we move forward in these times. And joining us to talk more about it is Jeffrey A. Flaks, President and CEO of Hartford HealthCare. Thank you for joining us.
My pleasure. Thank you, Lisa.
So let's talk about innovation. That's the buzzword today. It's played a key role in how your system has been able to pivot. Tell us about that.
Well, innovation has been critical throughout this crisis. I mean, I've been so proud to see the ingenuity that we're seeing in healthcare today. I look at examples, Lisa, where we have people who are making plastic face shields that can be worn in some of our care areas as opposed to masks, so that patients in hospitals can see the facial expressions, of their caregivers. We're seeing examples where our waiting rooms have really been eliminated, and we're using text services in our physician offices, so that we can safely move people in and out of these surroundings with really limited exposure. And we're seeing really high-tech innovation, things like split ventilator care, so that we can take ventilators and really double their capacity to care for more people if that becomes necessary. So these innovations are absolutely critical, and it's important that we continue to find new ways to move faster and make certain that we're here to take care of the community under all circumstances, and we're using all of our capabilities.
It's been amazing to watch. So just prior to the pandemic, Hartford HealthCare showed a commitment to innovation by signing a memorandum of understanding with the Israel Innovation Authority with the goal of Israeli tech companies coming to Connecticut to develop new products. Tell us how essential that partnership is.
Yeah, so the Israeli Innovation Institute is one of the worldwide leaders in innovation. And they have been assessing ways to bring the innovations they're creating in Israel and to really bring them to market throughout the world. And they selected 3 partners in the United States: Mayo Clinic, Jefferson Health System and Medical School in Philadelphia, and Hartford HealthCare, as well as a partner in Germany, in Berlin. So there's 4 centers who they've partnered with. And the real purpose is that they could look to take the things that have been developed over in Israel and to bring them here to our country, further develop them, trial them, and ultimately prepare them for being approved for use here within our country. So it's great for our community. It's great for Connecticut to bring these innovations here first, to give our team an opportunity to be part of the development process, and to ensure we have world-class care right here at home.
Wow, that's great to hear. All right, earlier this morning you held your daily media briefing with MIT about crisis. And how important is it to be able to adapt and adjust in a crisis?
It's critically important. And, MIT has been a wonderful partner to Hartford HealthCare for more than 5 years. And we had the Associate Dean of Innovation today. And Dr. Murray is a worldwide expert on this notion of crisis management and how it's driving now crisis innovation. And we have opened up Hartford HealthCare to assess us as a case study, share our information with MIT, and we're participating in the research. We're writing an article together and using some of our experience here and how it could help others manage through crisis. And as a learning organization, assessing how we can do things differently, do things better, and how we can share our story with others to the benefit of all.
Wow, it's been interesting. All right, I read an article that you said you have to throw out the book when the pandemic hit. What did you mean by that?
When I say throw out the book, in a crisis, we need to act fast. We need to accept sometimes that doing things with good information is better than waiting for it to be perfect. We need to act differently. We need to have more agility. We need to be more decisive. We need to be willing to fail fast. And we need to constantly be reassessing on a daily basis. So when I say throw out the book, you can't run a health system like ours the way we would in a conventional time period when we're facing a pandemic with a sense of community need that we were. We need to act and behave differently during this time period. And I'm really proud of the way our system has done that and has embraced the need to do whatever's necessary.
So many changes and so much telemedicine. All right. Jeffrey Flaks, President and CEO of Hartford HealthCare, as always, thank you for joining us.
Thank you, Lisa.